All right, it is noon, so we'll get started. We already have lots of people here, so thanks for showing up. Hello and welcome everyone. This is our second PPHA lunchtime education session of the year, and we are so excited to have three people here to talk about the 2020 Pennsylvania LGBTQ Health Needs Assessment. We've got Mara Ausendorf and Kelsey Wayworth Little from PHMC's Research and Evaluation Group, and we also have Christina Brosavage from the Bradbury Sullivan LGBT Community Center. They're going to give a great presentation today. So post your questions in the chat since there'll be a Q&A at the end. And yeah, I'll turn it over to them.
Great, thank you, Brooke. It's great to see so many folks on here who are excited to learn about the findings from the needs assessment, the LGBTQ Pennsylvania Health Needs Assessment. My name is Mara Ausendorf. I use she and her pronouns. I'm a project manager in the Research and Evaluation Group at Public Health Management Corporation here in Philly. And I work on a wide range of topics such as substance use, LGBTQ health, sexual health, tobacco use, and other topics.
Oh, and hi all. Yeah, it's really, it's great to see so many people. My name is Kelsey Weymouth Little. I use they and them pronouns. I am a research coordinator with the Research and Evaluation Group. I've been with R&E Group for about 2 years, and in addition to projects like this on LGBTQ health, I also work on projects related to tobacco use, substance use, education, and early childhood.
Hi, everyone. Thanks for having us. I'm Christina Brosavage, pronouns she, her, and I'm the Data and Evaluation Manager at Bradbury Sullivan LGBT Community Center. By nature of my job, almost all the health topics I work on are LGBTQ health related. In addition to the work we're going to be presenting today, I'm also involved in evaluating many of our community programs, pretty much all of our grant-based work, and was part of our new survey launch. We're doing a survey on vaccine hesitancy for the COVID-19 vaccine. And I'm gonna get us started. If Kelsey, you could share the slides. All right, and as has been mentioned, we're going to be talking today about the 2020 LGBTQ Health Needs Assessment. We're going to give you a little bit of an overview of some of the findings and some of the background work that went into this project. Next slide. We can just go right in. Some of the things we're going to cover today. I wanted to start by talking about Healthy People 2030 as well as health equity for all. And here we've got a statement from Healthy People 2030. People who identify as LGBT come from all races, ethnicities, religions, and economic backgrounds. The need to provide culturally appropriate preventative care will increase over the next decade. And some of the goals that are part of Healthy People 2030 that we identified as being really tied into the work that this survey represents is in eliminating health disparities and achieving health equity, and engaging leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being of all. And I see this presentation and the others that we've done like it as really being key to that, engaging the public across multiple sectors part of those goals, really not just collecting and analyzing this data, but getting it back out to providers, public health practitioners, and to the community. Next slide. The first iteration of the Pennsylvania LGBTQ Health Needs Assessment was instrumented in 2015-2016. It was a regional survey, and it was the very first one of this kind in Pennsylvania, and we got just over 4,000 respondents. Survey was revamped slightly for a statewide implementation in 2018 with some additional respondents there. 2019 really allowed the biggest revamp of this work including things like an improved survey design, additional questions about things like intersex traits, expanding a variety of questions we already had, asking about basic needs like housing and food insecurity, which in 2020 resulted in the largest survey respondent pool we've had so far, 6,582 respondents, which I consider to be absolutely huge. For comparison, the Behavioral Risk Factor Surveillance Survey, a national survey that's implemented at the state level, had between 6,000 and 7,000 respondents from Pennsylvania for 2019. So we're finally hitting a pool that's comparable to other statewide measures. This was also the largest known statewide data set of respondents with intersex traits. Pennsylvania, we had 110 total respondents identifying as having intersex traits. Next slide. I wanted to thank our project team, which includes Mara and Kelsey, who are on the call today, but also Jen Keith and Darby Andre from Public Health Management Corporation, Adrian Schenker, Katie Supez, and Liz Kaiser, also on my team at Bradbury Sullivan. This work would not be possible without a huge variety of partners, and particularly the expertise of Dr. Katie Dahlk from Penn State College of Medicine and Dr. Scout at the National LGBT Cancer Network. The Cancer Network also has a survey tool that's available to other states that they can utilize. Funding for this project and to complete the needs assessment and to connect all the necessary analyses was provided by the Pennsylvania Department of Health. There was also supplemental funding for expanded outreach provided by Adagio Health, Bloomberg American Health Initiative, the Erie County Health Department, Health Promotion Council, and the Philadelphia Department of Public Health. Next slide, please. We also had a wide array of data collection, media, and outreach partners, which allowed us to reach really all across the state. And Mara and Kelsey will be diving into that. Next slide. I think where this survey gets really exciting compared to the previous years is some of the design and promotion changes, as well as the difference in just the wider range of questions and answer options we were allowed to have. So this implementation of the survey in 2020 also included a Spanish language survey instrument, as well as outreach in both English and Spanish. We do feel that there may be need for more robust promotion of the Spanish language version of the survey in the future when this project is kicked off again in 2022. However, we felt that this was allowed us to reach a broader sample of PA residents. There was also targeted messaging to youth, transgender, Black, and Hispanic communities. And of course, there's no work of any kind in the past 12 months that was not touched by the COVID-19 pandemic. Changes to the survey administration due to COVID were that the survey had to be promoted primarily online. Data collection was completely online, and we also extended the data collection period to 10 weeks to make sure that we were reaching the respondents that we needed. Next slide. Really exciting are some of the new topics that were explored. I already mentioned asking respondents about intersex traits, but we also asked about various aspects of healthcare utilization that had not been previously included, including annual flu shots. Had you seen a dentist in the last year? We talked about community and partner violence, food and housing insecurity, lifetime experiences with discrimination, suicide, and self-harm. And we expanded a number of topics that have been included in the previous surveys. And these include things like sexual health, a huge array of questions on mental health, which I think are so important given the time period in which this survey was implemented. Data was collected between March and May of last year. We also asked about alcohol and other drug usage, about the usage of PrEP, HIV prophylaxis treatment, and a wide variety of barriers to care, things like access to insurance or distance to a provider. And I think this is where I'm going to turn things over to the PHMC team.
Great, thank you, Christina. This is a really exciting number to be showing you, the 6,582 LGBTQ Pennsylvanians that are included in this needs assessment. And that number is really a culmination of the work that Christina and her team did at Bradbury Sullivan and the local community centers that they worked with. So we put the number very big because we're very excited about it. From a researcher standpoint, this is really exciting to see that significant information about the LGBTQ population that we can garner from this. And it allows for looking at individual identities within our diverse community too. Next slide. So this map here shows the reach of the needs assessment, which reflects LGBTQ Pennsylvanians from across the state of Pennsylvania. All but 3 of the state's 67 counties are represented. Next slide. All right, so before diving into findings, we wanted to just take a moment to describe the sample so that you have a good understanding of who is included in the assessment, who are the identities that make up these findings. So you can see that more than 1 in 7 respondents identified as a gender other than man or woman. And I'll note that 44% of men, about 40% of women, that includes both transgender and cisgender men and women. And then on the right-hand side, you can see that most respondents identify as gay, bisexual, or pansexual, lesbian, or queer. So those are the sexual orientations that primarily make up the needs assessment. And then this year, like Christina mentioned, we asked about being born intersex, and 110 respondents identified themselves as such, which, as far as we know, is the largest intersex status set in the state. Next slide. So race and ethnicity, this is an area that we would like to see more diversity in the future, but we did see some increases in diversity this year. The majority of respondents are white. You can see that the racial makeup of respondents in the sample generally mirrors that of the general Pennsylvania population. So while we would like to see more diversity, it's not too far from the makeup of Pennsylvania. With one really important difference, though, is that this sample includes fewer Black and African American folks than the general population. And that's definitely a community that we would like to include at a higher rate and oversample so that their feedback is front and center. In terms of Hispanic and Latinx identity, that blue bar at the bottom, this sample is about the same as the general population. Next slide. All right, this year we had respondents from ages 8 to 92. And like Christina mentioned, we specifically worked on making the survey really youth-friendly and accessible to young people. And that resulted in a really excitingly large number of young respondents. Next slide. All right, so I wanted to try something to make it a little bit engaging. I've put up a whiteboard so that you can interact with the slide. Kelsey and I are going to present on a bunch of findings, some of the topics that are shown here, some other ones. And in the survey, we gave respondents the chance to tell us what they feel are the most important priority areas. We wanted to have you take a guess before we present. What do you think are the top 3 health issues that LGBTQ Pennsylvanians feel are the most important priorities to address in the community? So if you're new to the annotate function, if you go to view options and then select annotate and then use the stamp option, you can put a stamp on your top guesses. Great. And I know some of you have seen the report, so you might already know, and that's absolutely fine. Yeah, it's really interesting to see it. It looks like there's a spread with cancer and tobacco identified less option. There's less guesses there. And it looks like depression, suicide, loneliness, and isolation, as well as to some extent alcohol and substance addiction. And really all of these topic areas are so important to address in the community. I think it's really important that the survey asked what LGBTQ folks ourselves feel are our top priorities to address. So stay tuned. We'll reveal the results after the presentation, and you might get a sense of you might want to change your guess by the end of the presentation after we've presented some findings. So now the exciting part, I'll turn it over to Kelsey to talk about the findings.
Great. Thank you, Mara.
Oh, wait, one second. I think, is there a way to clear the...
Oh, perfect. Thank you.
Yeah, okay.
Awesome. All right. So just to kind of kick us off, we wanted to share this quote from former Pennsylvania Secretary of Health, Dr. Rachel Levine, who is excitingly the Biden administration's nominee for Assistant Health Secretary. And she said, "As a physician, I've seen the health consequences of neglecting a patient's needs. As a policymaker, I've seen the cost of creating policies that are uninformed. And as a transgender woman, I've felt the burden of others' ignorance. The saying is true that we haven't made progress unless we all make progress." And so with this biannual health needs assessment, we're really seeking to identify the health needs of this historically marginalized population of Pennsylvanians so as to create data-informed public policy. Moreover, we aim to spark discussions about the health disparities within the LGBTQ community so that we can ensure that we're making progress towards health equity for all LGBTQ Pennsylvanians. And so in the following slides, we're going to share some of the data we gathered from the 2020 LGBTQ health needs assessment that really sheds light on some of these health disparities. So first, we asked a lot of questions about kind of respondents' health overall, and respondents were asked to self-report their general health. And while the majority of respondents reported their health as good or very good or excellent, nearly a quarter self-reported their health as poor or fair. And this indicates a need for increased access to healthcare and health supports for LGBTQ Pennsylvanians. Notably, respondents do show a very high level of resiliency and interest in incorporating healthy living strategies into their lives. The majority of respondents, 58.9%, they're very or extremely interested in incorporating healthy living strategies. And 37.9%, so almost all of the rest of respondents, are somewhat or moderately interested. And the needs assessment really highlighted that many LGBTQ Pennsylvanians do not have routine access to primary care. 23.6% of respondents have not visited the doctor for a routine checkup in a year or longer. And 19.2% do not have a personal doctor or healthcare provider. That's basically 1 in 5, which is a very large number. And additionally, 36% have not visited the dentist in the past year, and 44.8%, which is almost half of respondents, have not had a flu vaccine in the past year. And so these statistics really raise the question, what are some of the barriers that LGBTQ Pennsylvanians might face in developing primary care relationships? So obviously, as I'm sure everybody knows, lack of health insurance is a major barrier in accessing healthcare, and it's critical to support all LGBTQ people in accessing the care they need, regardless of health insurance status. About 5% of respondents shared that they do not have health insurance, and about 21% receive insurance through Medicare, Medicaid, or CHIP. And notably, the percentage of uninsured respondents has decreased slightly since the 2018 assessment, where 5.9% reported that they did not have health insurance. We also asked respondents about their interactions with healthcare providers related to their LGBTQ identity and barriers they face in obtaining healthcare. Almost 1/4 of respondents have experienced a negative reaction from a healthcare provider when that provider learned their LGBTQ identity, and almost 1 in 5 are prevented from seeking care because they fear a negative reaction. About 1 in 10 are prevented from seeking care either because LGBTQ affirming providers are too far away or because LGBTQ affirming providers are not covered by their health insurance. About 1/4 have not disclosed their LGBTQ identity to any of their healthcare providers. And 1/4 do not believe that their healthcare providers are culturally competent with respect to the LGBTQ community, and more than 1/3 do not believe that their healthcare providers have medical expertise related to their health needs as an LGBTQ person. And these findings really show that a significant number of LGBTQ Pennsylvanians face significant barriers in accessing affirming competent healthcare. Combined, 1 in 3 respondents fear seeking healthcare services because of either past or potential negative reactions from healthcare providers related to their LGBTQ identity. Those respondents who are sometimes or always read as LGBTQ in public, which is 80.3% of respondents, are more likely to experience a negative reaction from a healthcare provider when that provider learned they're LGBTQ. Therefore, it's critical to train healthcare providers to be LGBTQ affirming and competent. And so we really just wanted to share some ways that pretty much anyone can, regardless of your role, can support LGBTQ clients and community members. Being welcoming, accepting, and non-judgmental. When asking about sexual orientation, such as on an intake form or other paperwork, include several options in addition to gay or lesbian and straight. Some of those options you can include are bisexual, pansexual, queer, and asexual. And it's also important to include a write-in option and allow clients to select more than one option. Don't assume someone's identity based on their presentation, either assuming that they are LGBTQ or that they aren't because of how they look. Ask all of your clients for the same information to inform the services you provide. Have a list of LGBTQ competent health resources to refer people to. And apologize if you make a mistake, such as making an assumption about someone's sexual orientation or gender identity or using the wrong pronouns. And you shouldn't dwell on a mistake or repeatedly apologize because that may cause the person to feel uncomfortable, but you can just apologize once and make an effort to avoid the same mistake in the future. We also wanted to highlight kind of transgender specific healthcare experiences among transgender respondents. So more than 1 in 3 transgender, non-binary, or genderqueer respondents have experienced a negative reaction from a healthcare provider when the provider learned their LGBTQ identity. This is a significantly higher percentage than for cisgender LGBTQ respondents, only 18.6% of whom have had this experience. And therefore, it's really crucial to expand knowledge of any kind of health-related providers in transgender health. So what are some ways to support transgender clients and community members? So ask people for their pronouns and ask everyone for their pronouns, not just people who you think may be transgender. And it's also really important to share your own pronouns, to normalize pronoun sharing for everyone, not just trans people. Ask clients to share the name they want to be called and differentiate this from their legal name or the name on their insurance. Distinguish between sex assigned at birth and gender identity on intake forms and other paperwork. And when you're asking about gender identity, include options beyond male and female, such as non-binary and genderqueer, as well as a write-in option. Offer gender-neutral restrooms and other facilities for clients, not just men's and women's, and make sure that those restrooms are easily accessible. Learn about terminology and medical issues related to medical transition, including hormone therapy and gender-affirming surgeries. However, don't assume that all transgender people have or want to medically transition. Support clients in accessing medical care related to transition if desired. And lastly, protect client privacy to ensure that clients aren't outed without their consent. So for example, this could include using gender neutral language to refer to clients in waiting areas and making sure to always refer to clients by their preferred name, not their legal name. And one part of the LGBTQ needs assessment that I think was really great because it allowed respondents to kind of really give us their feedback in their own words. And so we asked respondents, what is one thing you would like to tell healthcare providers to be more welcoming? And we got an array of really important and valuable responses. These are just a few of them. And I just wanted to read a subset of these on the slide out loud to really just highlight and emphasize this important feedback. So one person said, ask everyone their pronouns. Another person said, just because we don't look gay doesn't mean we are not gay. Please be mindful of body language and facial expressions when someone confides that they are LGBTQ+. I know that sex on the intake forms is needed for medical reasons, but it would be great if you could also include gender and pronouns on the forms. If you claim competence, I should not be put in a position of educating you on basic care. If you do not claim competence, at least be prepared for an LGBTQ person to walk through your door. And I'm going to turn it back over to Mara to go over some more of our findings.
Thank you, Kelsey. That's really important information. I think the access to welcoming care was such a big takeaway from this year's needs assessment. So this next section is about what we might consider basic needs, or those needs that are just fundamental to life. So one of the questions asked was whether at the end of the month they had plenty of money left over, some money left over, just enough to make ends meet, or not enough to make ends meet. And we found that more than 40% don't have any money left over at the end of the month. This percent was even higher for respondents of color and was higher for trans, non-binary, and genderqueer respondents. So that's pretty striking. Next slide. We also found that more than 30% of people of color and trans, non-binary, and genderqueer respondents had experienced homelessness in their lifetime. Again, I think those percents are a lot higher than, than all respondents, as well as the general population. Next slide. Respondents were asked how often this statement was true. I worried whether my food would run out before I got money to buy more. And this was sometimes or often true for a quarter of all respondents, and 37% of people of color, and a third of trans, non-binary, and genderqueer respondents. Next slide. 46% of respondents had experienced violence, and more than half of people of color and trans, non-binary, and genderqueer respondents had experienced violence. So these percents are very striking and important to note. What's not on this slide, but I wanted to note, was that nearly a quarter of respondents reported that they had experienced violence that they indicated was specifically based on their LGBTQ identity. So, these are areas that we would consider core to survival, and we're seeing these large percentages of respondents facing these challenges. Next slide. Okay, taking a look at tobacco use, we know historically the targeting and advertising from the tobacco industry towards the LGBTQ community. And this year we found that half of respondents had ever used cigarettes, and this percentage was much higher than in 2018, as you can see in that those purple bars. Ever using e-cigarettes was also higher this year. And then compared to 2018, the percentages of those who have used hookah, cigars, and chewing tobacco were smaller this year. So it's really interesting to see this comparison, and it'll be really important to look at these trends over the next few years as well. Overall, 59% of respondents had ever used any tobacco product, and this was higher for respondents of color and for bisexual or pansexual respondents. So anyone working in tobacco cessation, those might be some target populations for you. Next slide. So substance use, this is kind of substance use by the numbers here. We know that this is an important area in the LGBTQ community and other disenfranchised communities. And we found that small but significant percents of respondents reported using substances. So you can read through these, but I'm just going to zero in on the 28%. We found that 28% of respondents have used alcohol or substances to help them have sex. And among men and genderqueer respondents, the percent engaging in chemsex is even higher, at about 36, 38%. What we also saw was that about 10% of respondents have sought treatment for their substance use. So that was really great to see. However, we also found that a little more than 7% had a negative experience from an alcohol or drug treatment provider based on their LGBTQ identity. That may seem like a small percent, just 7%, but that, just to put it in perspective, that's more than 200 respondents who are essentially reporting, experiencing homophobia in their alcohol or drug treatment. So that's definitely something that, that work needs to be done in. All right, next slide.
All right, so I'm going to talk a little bit about some of the mental health findings from the assessment. So we asked respondents a series of questions related to mental health. And so we asked respondents basically like how satisfied they are with their life overall. And while the majority of respondents, 69.1%, reported being satisfied or very satisfied with their life, more than 1 in 4 respondents, or 30.9%, reported being dissatisfied or very dissatisfied. And notably, these percentages are pretty similar to the 2018 needs assessment, where 3 out of 4 respondents, 72.6%, reported being satisfied with their life, and 1 out of 4, 27.4%, reported being dissatisfied. So it's increase of a couple percentage points in this assessment of respondents who reported being dissatisfied with their life overall. And we also asked respondents how often they feel they receive the social and emotional support they need. And almost 1 in 5 respondents, 19.5%, reported that in the past year, they rarely or never received the social or emotional support they need, which is, again, 1 in 5 is just a really striking percentage. And this is slightly higher than from the 2018 needs assessment, where 16.2% reported rarely or never receiving the social or emotional support they need. Additionally, we also asked respondents some other kind of related questions, and about 1/3 of respondents reported often or always lacking companionship, feeling left out, or feeling isolated in the past year. And it is worth noting that the needs assessment survey, as Christina mentioned at the beginning, was administered between March and May 2020 at the start of the COVID-19 pandemic in Pennsylvania. And so stay-at-home orders and physical distancing restrictions may have contributed to the high percentages of respondents reporting feelings of isolation. However, since respondents were asked to reflect on the entire past year, not just the past 1 or 2 months, COVID-19 pandemic alone does not fully explain these findings. We also asked respondents about experiencing a mental health challenge in the past year. 72.9% of respondents reported experiencing a mental health challenge in the past year, and of those respondents, only 61.9% have received counseling or other mental health treatment in the past year. And so we kind of wanted to break this down and make it a little easier to visualize. So if you think of all the respondents as 10 people, which are the 10 people shown on the slide, 7 of those people have experienced a mental health challenge in the past year. And of those 7 people who've experienced a mental health challenge, 3 of them, which is almost half, have not received counseling or mental health treatment in the past year. And so these findings really show that there's a need for increased access to mental health treatment in the LGBTQ community. Rates of considering suicide are also high in the LGBTQ community. Over half of respondents, 56.2%, have considered suicide in their lifetime. And these rates are even higher for LGBTQ youth, transgender people, and bisexual, pansexual, asexual, demisexual, and queer people. And notably, As the slide highlights, about 3 in 4 transgender, non-binary, or genderqueer respondents have considered suicide in their lifetime. We also asked respondents about thoughts of self-harm, and over half of respondents, 53.3%, have ever thought of harming themselves. And of those respondents, 85.6%, so the vast majority, first had those thoughts of self-harm at age 19 or younger. And so these findings around mental health really show an urgent need for competent, accessible mental health supports for the LGBTQ community, and especially for LGBTQ youth and transgender people.
All right, thanks, Kelsey. So that concludes the majority of the findings. So I just wanted to put this slide back up and have you pull out your stamps again and think about whether your guess would change or stay the same after what you've learned today. So again, if you go to view options and then annotate, and then you can choose the stamp function. Yeah, so you can already see that it's clear that mental health and behavioral health are really important health issues in the LGBTQ community. So if you go to the next slide, Kelsey, drum roll, please. So these are the results. When asked what the top priorities, what the top health priorities are in the community, LGBTQ Pennsylvanians felt that depression, suicide, and alcohol and substance addiction were the most important to address. If you go to the next slide. So you can see that depression is at the top with a little over 64% of respondents having selected that as one of the top issues. But you can see that you know, a lot of folks selected loneliness and isolation, and some of these other pieces are also mental health related or behavioral health related. And so I think that's you know, important to note that these top issues are all behavioral health related. We saw in the findings that some of the other health issues are very much impacting the community, such as tobacco use and other, you know, other topic areas that you can read more about in the full report. But one of the things that I take away from this is that, you know, when we're working on some of these other health issues with the LGBTQ community, it may be important to address some of these priorities alongside these other issues. All right, next slide. I think I'm passing it over to Christina now.
All right, and so in summary of not just the things that we've presented today, but the findings that you can read about in the full report, that there are certainly numerous and pervasive health challenges that impact the LGBTQ community, some of which were highlighted here, particularly the mental health challenges, access to care, and issues with tobacco use. However, resiliency factors within the community are strong. We asked a variety of questions about interest in healthy living strategies, including tobacco cessation, and found that there was great interest in those, and that interest in tobacco cessation had increased from the previous assessment. However, there's a lot more work that we need to do at various levels to achieve health equity. We also need more data, particularly on LGBTQ communities of color and LGBTQ older adults to address the unique needs those communities face. Next slide. You can find these recommendations in the full report, but I wanted to review them here. Perhaps number one, not just on this list, but something to be thinking about, is supporting connections to LGBTQ competent providers. That access to welcoming care is so important and could help with many of these issues. We also need to support initiatives that address the social determinants of health, which is what I meant by addressing things from all levels, not just care in a provider's office, but accessing the things around us. Everything from housing and safety to tobacco control. Identify community-wide mental health supports. Support chronic disease prevention. Another topic that you can find in the full report is about recommended health screenings. Are members of the LGBTQ community receiving appropriate screenings for things like cancer and diabetes? Always, always, always promoting tobacco cessation opportunities. And I was looking through the participant list and I noted that we've got a lot of people on the call that I know are engaged in that work. As I said, encouraging health screening discussions as well as health education. Bolstering community supports, particularly for Black, Indigenous, and people of color. Prioritizing the health needs of transgender, non-binary, genderqueer, and intersex individuals. Continuing to enhance our data collection. And we're currently working towards some of the changes and how we're going to strengthen this survey for 2022. And continuing partnering with LGBTQ community-based organizations. And I actually saw a few people on the call that I would say represent those organizations that have been instrumental to not only collecting this data, but as I mentioned in the very beginning, disseminating it back out into the community. Next slide. You might be wondering, how can I access this data? If you are a researcher, a member of a state agency, or a representative of a provider's office or a hospital network, you can contact Jen Keith, and I actually think she's on the call, and she can provide you with an application to access de-identified data. This data is owned by the Department of Health, and so that process goes through them, but de-identified data is available for your use. And for anyone who can make use of it, I certainly encourage you to do so. I spent a lot of time looking at this data and it's full of some really exciting things, many, many more than we could cover in a single presentation or a report. But we also wanted to make this data available to community-based organizations, most of which do not have a data and evaluation manager available to crunch numbers and create reports. So I want to position myself as a resource to those organizations. We've already provided a number of data summaries to the partner organizations that helped with data collection. Data summaries have also been provided to the regional primary contractors from the Division of Tobacco Prevention and Control. Some of the ways this data has been used is in LGBT community centers applying for grant funding. Some have used it for informing their own programming. Others have just used it for educating the community, particularly in the area of tobacco prevention. I will throw out the caveat that we cannot report on groups representing fewer responses, just to protect the integrity of the data as well as the privacy of our respondents. Next slide, please. And I wanted to talk just really briefly about planning for the future. And I think there were some questions in the chat about this that we could address more specifically. But some of the things that we've already begun to discuss are creating more promotional materials in Spanish to increase participation in our Spanish language survey. We need to consider ways that we can enhance data collection for rural communities. Due to the COVID-19 pandemic, data collection was entirely online, but we did recognize that that meant we may not have gotten responses from communities without access to high-speed internet, as well as older adults. We want to continue our targeted outreach to increase participation from asexual, transgender, non-binary, intersex, older adults, Black and Asian and Pacific Islander communities. Mara had noted that although the overall respondent pool resembles the makeup of Pennsylvania, I think someone asked where that data came from. The comparison data was census data. We do see that outreach is needed to some specific communities. And I will throw out the note that the way we ask that question, I feel is more inclusive, allowing respondents to identify multiple aspects of their identity, whereas the census data, you're kind of boxed into a single response. So it's not a perfect comparison, but it definitely shows us some places that we would maybe want to reach. And as I said, targeted outreach to populations that maybe don't have internet access, because those may be the most vulnerable members of our community. Next slide. And we encourage you to check out the full report. It's full of graphics, more details on our findings. And you can find that at livehealthypa.com/LGBT. And I think we're ready to open things up for questions.
Amazing. Thank you so much for that presentation. I found it really insightful, and I especially liked how you paired the kind of more quantitative data with specific steps that we can take to make more inclusive and healthy spaces in our own lives. I have some questions from the chat. The first one is just logistic. Will these slides be available after the presentation?
Yes, we can make them available.
Okay, great. Yeah, so I can send those out to the people who were in this presentation. It also has been recorded, and our plan is to put up all of our education session videos on the PPHA website. The next question we have is, what are some of the promotional methods you use to target youth in diverse communities?
I think Christina is probably the best person to talk about recruitment because her organization led a lot of that. But I can jump on and talk a little bit more about youth targeting as well after you go.
Sure, especially looking at the diverse communities. I'm thinking particularly of our transgender communities as well as communities of color. That was a place where we really relied on our data collection partners. You may remember that very long list. It's also in the full report. It is full of community organizations that serve those diverse communities. I'm thinking specifically of, I believe, the William Wade Center in Philadelphia and Sisters Pittsburgh. They serve, inner city youth, and Sisters Pittsburgh serves transgender individuals living in Pittsburgh, and they're specifically a community of color. That those groups are instrumental in us being able to reach the diverseness of the LGBT community in Pennsylvania, and just being able to partner with centers in different geographic areas, because there's a lot of geographic variability in this data. It's really interesting to see, including in what the disparities as well as what the community priorities were. And it was by partnering with those organizations that we were really able to reach people that Bradbury Sullivan could not have reached alone, or that PHNC could not have reached alone.
Yeah, and I'll just add in a little bit about targeting youth, which is such an important LGBTQ community with some of their own risk factors and vulnerabilities. So similarly, Christina's organization, Bradbury Sullivan, worked with some youth-focused organizations to administer the online survey. We also did things like we checked for reading level in the survey to make sure that it was accessible, as well as in the FAQ page to make sure that all of the information about the survey was provided in a way that would be accessible. And checking for reading level is something that we like to do regardless, but especially important for our youth. We also did some specific Instagram social media posts and some flyers that went home to youth that are connected with youth LGBTQ centers. And so, the Instagram is a great place to reach youth. So we did some paid promotions through that and made the advertisements of it, the promotions of it geared towards youth and a bit social justice oriented to indicate that this is a way that they can share their voice, that they can make their feedback heard, and their experiences included in this.
Thank you. Did you use any influencers?
We didn't. It was primarily posted on Bradbury Sullivan's Instagram page, but I love that idea of using influencers, and there are definitely LGBTQ youth Pennsylvanians who are Instagrammers that we should consider partnering with.
Thank you.
Yeah, thank you.
Great. I'm going to skip ahead to another question because Christina started to address this in her answer. But did you find that the results varied substantially by region, for example, rural versus urban respondents?
I'll take a first crack at it. One of the things I've been doing, as I mentioned, was creating summaries for some of our different partner organizations, as well as we've done some regional presentations that have included Northeastern PA and specifically Philly County and Erie County. And I'd say that there is some geographic variability. There's some differences, for example, in the types of tobacco products that are used in specific regions, cigarettes and e-cigarettes always being the number 1 and 2, but some changes in some of those other products. I also noted things like we had asked about distance to a provider being a barrier, and that seems to be more prevalent in rural areas versus urban, which I think makes a lot of sense. Whereas other things like insurance maybe are sort of across the board barriers. And I don't know if Kelsey or Mara, you've also spent a lot of time looking at this data, if there was anything that you've noted.
Yeah, I just want to put in a plug for, again, taking a look at the full report, because one thing we do have included in there is at the end, we have appendices that basically are like one-page summaries highlighting different communities. And in part, we have a one-page summary for each of the, I believe it's 8 tobacco regions. So basically geographic regions in Pennsylvania. And that's just kind of the tip of the iceberg in terms of regional differences, but it does highlight some interesting differences in addition to tobacco use and like types of tobacco products used, like Christina mentioned. Also some interesting regional differences around, for example, we asked respondents about experiences of different risk factors for HIV. And so there's definitely some interesting regional differences around that as well that are highlighted in the one-pagers.
Great, thank you. Where did you get the Pennsylvania demographic statistics from? Was this from the census?
The chart on racial and ethnic statistics. Yeah, that was I believe either on the PA Department of Health or maybe just on the CDC. There's lots of portals out there that exist that you can play around with census data. And I believe it's the 2019 census data that was from. It was the most recent available. It was not 2020, but it was whatever was the most current at the time we put these slides together.
Do you have any data on whether the violence that the survey referred to was more tied to discrimination or partner violence?
I believe we asked 2 questions about violence. Correct me if I'm wrong, Mara. And for the purposes of the slide, we included anyone who had experienced either. So certainly there were some who had experienced both, but to sort of provide a summary. And I believe that the breakdown is presented in the full report.
Yeah, so so we had those 2 questions, and those who experienced violence from a family member, partner, or spouse was 37%. And then those who experienced violence based on their LGBTQ status was about 24%.
All right. We have another one. How does the mental health of LGBTQ Pennsylvanians compare to that of the overall population?
I can speak a little bit about this, but I think Kelsey has done a lot of work looking at the mental health variables. So I don't know if they have anything to specifically answer this. But I think what we see is a lot of risk factors in the LGBTQ community that are heightened in this community than in the general population. And so I know that this information exists, but I don't have it off the top of my head, the exact comparisons. But we do have some measures that are in the needs assessment that can be directly compared to BRIFIS. So things like, how satisfied are you with your life? Do you get the emotional support that you need. And we found that on some of these, direct measure comparisons, that there were definitely heightened risk and experiences in the LGBTQ community in this sample.
Yeah, absolutely. Yeah, and just to add to what Mara said about kind of like, like risk factors, other social factors that might influence like mental health, we did find that 60%, more than 60% of respondents reported ever experiencing discrimination based on their LGBTQ status, which is 6 out of 10, a huge number. And obviously, of experiences of discrimination can significantly influence one's mental health. And I think also our findings really highlight the indirectly highlight the effects of kind of social experiences and discrimination on mental health well-being, because populations that are further marginalized within the LGBTQ community, such as people of color and transgender, non-binary, and genderqueer people, pretty much across the board experienced greater mental health disparities and more mental health challenges than the general LGBTQ population.
I'll just tack on, because while Kelsey was talking, I pulled up one of those measures that's comparable just really quick. So BRIFIS indicates that the general population, 94% are satisfied or very satisfied with their life. And in the LGBTQ needs assessment, we found that 69% are satisfied or very satisfied. And so, that 69%, that is the majority, but that is a significant percent who are indicating dissatisfied or very dissatisfied with their life. And so, that's just one of the comparisons, but it's definitely a stark disparity.
This next one I think is interesting. And it asks, will there be any new or updated questions in the 2021 survey?
Great question. We are definitely talking about some of the changes that will be made to the 2022 survey. And so I think that we will, adjust some of the ways that some of the questions are answered. And we're going to try and keep some of the questions exactly the same so that we can do a really rigorous monitoring of trends over time. So I think we're definitely thinking about those pieces, and they're still being solidified. Christina, do you have anything to add?
I would say that we're still really coming out of this survey and disseminating the results, but I think some of our very informal planning would be, certainly when we were putting together this report, there were things that we found really interesting, and we've talked about, even the questions that have been asked in each survey, we've always improved them as time went on. Even just in the questions we asked about gender and orientation, there were additional options. Kelsey mentioned the importance of having a write-in option, and just making improvements like that are always going to continue, even when they're not, tied to a specific topic area. I would love it if we had questions about COVID vaccination in our future survey, but I think there's probably 101 things that if there was no limit for length or how long it would take people to take the survey, there are things we would add, but we're always really mindful of the user friendliness of the design.
Thank you. We are right about 1 o'clock, so I'm just going to close the questions now to be respectful of everyone's time. But I definitely encourage everyone to, first off, read the full report. It's so interesting. These guys put a ton of work into it. And second, I'll ask them to drop their contact information in the chat in case you have any other questions. And again, reach out if you have specific data requests, because this data is really meant to be accessible to all Pennsylvanians. Thank you for an amazing presentation, guys. I think that this was just such a great thing to be able to provide to PPHA.
I think Jen put the link to the full report and her and my contact information in the chat as well. So please, people, reach out and read that full report. has a lot of great stuff in it. And thank you.
Thank you so much, Brooke, and everyone. This was really exciting to share this information. So please check out the full report, share it with your networks. We want this information to actually be used for programs and policy change and supporting the LGBTQ community. So definitely feel free to reach out with questions too. I put my email address in there, and Kelsey has that too. So thank you so much for coming.
Great. Thanks so much, everyone. Bye.